Commissioner. Good morning. Uh, you mentioned earlier that there's no longer discussions of the merger of Oasis with mental health. Can you let us know what efforts are underway to deal with the dual diagnosis issues that are prevalent in our communities?
Yeah, we're working very, very closely with Dr. Cunningham in OASS. A couple of major initiatives. One is that our crisis stabilization centers, which are coming up, are being dually established, dually developed by both of us with full capacity to treat both substance use and mental health and all the crossovers. Our CCBHCs, which are certified community behavioral health centers, by them being designated as such, must have integrated care and have done a really great job at integrating substance use. We have 13 of those sites and an additional 20 that have some funding from the federal government. All of those are required to do integrated care. We recently did a collaborative with us, Oasis, and emergency rooms across the state that involved 100 of our medical emergency rooms on how to deal with crises that come in, whether it's an overdose or a suicide attempt or a sort of violence. And we're working together with Oasis, with all those emergency rooms on the standards that should be utilized for care. So there's a lot of collaboration going on between the agencies at the level of actually providing care. And we're going to continue to work to grow that, even if we're separate agencies.
Well, thank you for that, and I encourage you to continue that because that's a significant issue in our communities. I think both rural, suburban, and urban as well. As you know, our jails, our local jails, had been kind of a last resort provider of mental health services to many incarcerated individuals in the community, and now with no bail, those individuals are not getting incarcerated. And I'm not suggesting that the jail should be used for mental health treatment, but that's in fact what they've been doing for many years with the lack of services in the community. So now we have this revolving door. The citizens in my communities,
So they're still on.
Makes no difference to them whether they're victimized by a bad guy or a mentally ill person. We need to have better services to stop these individuals from just being a revolving door in our criminal justice system and risking the safety of our communities. What's being done about that?
I think there's two things. One, I think, is working with individuals who are brought into the criminal justice system, is that diversion point. And there's a number of programs that we have established across the state in various jurisdictions to have mental health workers there, whether it's sometimes it's pre-arraignment, sometimes it's post-arraignment, sometimes it's a discharge from jail, to work with individuals. And I think that's something that we absolutely have to continue to grow. Bail reform has meant, yes, that less people are being actually in the jail. So at the point where they are seen by the judge, there needs to be people there to work with individuals that they can easily connect with that individual, to work with them, to enable them to get into the services that they need. So it's a little bit different, and we have been setting these up in various communities across the state, and we'll have to continue to grow that. It's very important to capture people when you can get to them.
Yeah, exactly. I agree wholeheartedly with that. And unfortunately, that is what our jails were doing for a long period of time. And I'm not so sure that just a judge telling somebody, you're not setting bail, but you got to go to this outpatient clinic or treatment is going to be the answer, because a lot of these individuals just aren't going to show up. And they're going to end up right back in front of another judge on a different charge. So, we're really lacking in inpatient options for judges or just the community in general. Because the beds have been cut back so much, particularly in our rural areas, when it takes an hour and a half, 2 hours to get to a treatment facility. So we really need to ramp up our efforts on inpatient options for everybody. And I'm not just talking about those that commit crimes, but for everybody with significant mental illnesses that need that because they're not compliant with their medications or their treatment protocols. But thank you very much.